Hello, everyone. I want to specially welcome you to a brand new year, the year 2025. This year, we'll be continuing with our podcast series, and today we've got a big fish. We've got a dentist on the show.
Can you please briefly introduce yourself?
My name is IsaacK Adeyemi.
Okay.
All right. I'm a dental surgeon based in Nigeria. I practice as a general dentist in Ibadan, Oyo State, Nigeria.
Thank you very much. So the first question I would like to ask you, how does excessive sugar contribute to tooth decay? And what are some of the common misconceptions people have about sugar and dental health?
Concerning sugar and tooth decay, the way it works is there are bacteria in the mouth that are associated with tooth decay. So for every tooth in the mouth, the outer layer of the tooth is called enamel. It's the strongest thing in the entire body. So how sugar contributes to causing tooth decay is that the bacteria in the mouth associated with tooth decay acts on sugar, then produces some kind of acid that eats up that enamel. I said earlier that enamel is the strongest in the body. Very, very strong. So tooth decay starts very small because when the bacteria that is associated with decay, when it acts on that sugar, all right, it produces that acid that gradually eats up the enamel, and that enamel, once that decay starts, when I said eats up the enamel, that's what I'm referring to. That is what we call tooth decay. All right, so once that decay starts, the enamel will start, decay will start getting deeper, as it were. And then from that outer layer, which is the very strong enamel, it gets to other deeper parts of the tooth, causing more problems of pain and other complications. That is mostly how refined sugar. When I say refined sugar now, I mean sugar present in most of our carbonated drinks. Refined sugar we add to our tea, pap, and all of that. I'm not talking about sugar in the broadest sense of it, because carbohydrates contain sugar. The biggest problem is with refined sugar, the kind of sugar in chocolate, in carbonated drinks,
Soft
the kind of
drinks.
soft drinks. That's why we advise regular dental checkups, because the third decay starts very small. If you come for a checkup, we quickly detect it before it gets deeper, because the deeper it goes, the bigger the problem. Once it gets too deep, getting to where the nerve of the tooth is and all that becomes a big problem. You start talking about doing extensive treatments or even removing the tooth, and nobody wants that.
Thank you very much for that apt, very educative response. I'm curious to know how much of sugar is enough or that could cause damage.
It's a bit dicey question, but I'll just try and respond the way, because these are regular questions we get from patients. Basically, what we advise is, as much as possible, you try to reduce to the barest minimum. It's practically not likely to tell someone not to take refined sugar. Stop taking. In most cases, when people do that, you find that they're not even able to sustain it. Maybe because they just had a tooth extraction last week, and they're saying, okay, I want to stay off sugar. They're able to do it for a month, and they're back doing the same things they've been doing. So we just advise that try and cut your sugar intake down as much as possible to the purest minimum. And it's not just about cutting down sugar, though. There are other things involved too. You keep a good oral hygiene. You brush twice daily, once in the morning, the last thing before going to bed. Also, there is a particular hack. We are also advised that when you want to take sugary things, let it coincide with when you are taking a meal such that there's breakfast, lunch, and dinner. Instead of you took your breakfast by 8 a.m., you want to take your lunch by 1. So instead of taking a bottle of Coke by 11 a.m., let that bottle of Coke coincide with when you are taking your lunch. There's a reason for that. Has to do with that enamel and all that. The attack on the enamel. For the sake of this conversation, let's say there's an attack by sugar on it. Mix of sugar and bacteria. So when you do it like that, when you take your refined sugar, when you take it together with your meal, you put that attack, instead of spreading the attacks to different times of the day, it is done once, and it's easier for that enamel to recover. There's a way the body also has its mechanism of recovering, even when there's an assault of bacteria and sugar on the tooth. There's a natural way the body also tries to recover. Problem is when you now take it at separate times of the day, at 2 hours, the enamel keeps getting assaulted by the bacteria and sugar and all that. But that's not an excuse to now be taking it excessively too. You mix that with reducing your sugar intake to the barest minimum for you and keeping a very good origin and coming for regular dental checkup. You can literally have a lifetime free of dental problems.
Next thing I want us to speak or talk about is dental cavity, which many of us call hole in the teeth. As an expert in this field, how many of these cases do you see often? Then, what causes a hole in the teeth?
What we call tooth cavity or dental cavity or hole in the tooth is still what I refer to as tooth decay.
Okay.
Is it decay? When I said that acid, the bacteria will act on the sugar, producing some form of acid that eats up the tooth. That eating up creates hole and cavity. When it comes to how often we see, it's almost every day. Tooth decay is the most prevalent. Even statistics show that tooth decay is the most prevalent dental problem in the world. In fact, of all diseases, tooth decay is one of the commonest diseases, and it's always unfortunate that most times patients present late. In the sense, I said the other time that the decay or the hole or the cavity starts very small, then gets deeper and wider with time. So if you're someone who comes for regular dental checkups and catch it early, it's always there to fix. But once it's so late, it's become usual for me to get to the office in the morning and see someone that has been that has been around since maybe 7 a.m. or before 7 a.m. because they couldn't sleep. The pain was so much. Some people have rated toothache to be worse than labor pain, to be the worst pain they've ever experienced in their life. Toothache can be like that. I've seen patients crying because of toothache. It doesn't have to be like that. I tell patients all the time. And it's not about your mouth alone, it's about the entire body. When you notice something in your mouth, you notice that food is getting stuck somewhere. And maybe when that food enters, you feel small pain. Why not come immediately? Why must you wait until there's now a big swelling when the whole tooth is now infected, extending to the jaw? Because tooth decay can kill. We've seen that very often. We've seen that very, very well because once the infection spreads beyond the tooth, spreads into the jaw and the surrounding tissues, spreads and causes very terrible complications and all that, it can kill. It can lead to something you need to do a major surgery for and things like that. So we try to encourage patients to present early. That's why we do so much health education online, offline, try to educate patients. Because I make it a point of this to try and educate patients. It's not just about coming and me removing your tooth. I don't want you to come back next year again or in another 2 years saying that another tooth up here is not paying you that you should remove it. I've seen patients who are not even 30 years old who have had to extract up to 5 or 6 teeth.
Wow.
I'm always particularly pained when I see things like that because that didn't have to happen. It's not just about your mouth alone. Even for cases of cancer, if you present early, most cancers are in stages. If you present early, the likelihood of a treatment being done that would give you a good outcome, as it were, is likelier that you get a good outcome with the treatment you present early than someone who's presenting late or when the whole thing has spread to other parts of the body. That money you don't want to spend, you would eventually spend times 10 times 20 of it if you don't come early. Right, so how to prevent it? I've already mentioned that I've said things like that earlier. You reduce your sugar intake. It's not just for the mouth alone. Excess sugar consumption does a lot of damage in the body. Generally, keep a very good oral hygiene. Brush twice daily, not with a hard brush, something medium, not so hard, not too soft. Your toothpaste, make sure it has fluoride. Fluoride also helps to fight tooth cavity. Many people propagating lies against fluoride today, saying fluoride is harmful, don't use fluoride, and stuff like that. That's not true. There's not there's enough scientific evidence to show us that fluoride works in the minimal quantity in toothpaste is very safe. It's only harmful in toxic quantities. Very importantly, I like to really emphasize this. Come for regular dental checkups. When you come for regular dental checkups, we do the regular cleaning for you. We call it scaling and polishing. The kind of treatment where you clean all your teeth professionally. Does not mean if you brushing 10 times a day. Everyone should do that every 6 months. You should have dental checkup every 6 months. And right here in Nigeria, that's not so expensive. So you do all this, even if it's there to be caught early, and once it's caught early, you are fine. We'll remove the parts that is decayed, we fill it, we have materials, we have
Mm.
specially made materials, dental
Mm.
materials that we use to fix the decay.
Thank you very much. I have one more last question on dental cavity. It has to do with removing of tooth. Because every cavity has to lead to people getting their teeth removed, or some can be managed.
I say all the time that no dentist likes to remove teeth. We don't like it. People don't believe. We only do that when there is no other option. Tooth decay does not mean that the tooth has to be removed. Not at all.
Mhm.
Treatment will depend on the extent of the decay. I've been trying to emphasize this too, that the extent of decay, how deep it is, will determine how the complications and the treatment. I was saying the other time that the decay, if you come early and the decay is not deep, you can quickly fix it. All right, so the treatment will determine the treatment is dependent on how deep the decay is. If the decay is not very deep, it can be fixed with just a simple filling. Would remove the part of the tooth that is decayed, then we'll fill up the decay or hole or cavity as it is. If it's very deep, getting to the nerve of the tooth, each tooth in the mouth is a living tissue, which means it has blood supply to it. It
Mm.
has nerves entering. If it has gotten to all those sensitive parts, if the guy has gotten that deep to all those sensitive parts, that's when there's always severe pain and swelling and all that. So instead of removing, there's another treatment that can be done. It's called the root canal treatment.
Mm.
Root canal treatment. It's a treatment where we remove the nerve of the tooth, remove the blood vessels and all that. Do the treatment basically. After doing that, we clean the entire tooth to the deepest part, and all that we shall the root canal treatment is an alternative to extracting the tooth. But the problem here is at times the patients can't afford it because it's usually more expensive than extraction. So at times patients can afford it. That's in my own practice, that's usually a problem. In fact, these days where the economy is 8 out of 10 patients can't afford it.
Mm.
I'm speaking about Ibadan here where I practice. Because after the root canal treatment, you have to do something called a crown too.
Mm.
Don't mind all the jargon. A crown is just basically after the root canal treatment to place that thing is like a cap or place on the tooth, but very, very strong so that the tooth can be strong. We sit it on the tooth so that the tooth is fine. And that crown can be quite expensive too.
Mm.
So by the time we bill all that together for the patients, most patients are usually like, I'd rather remove it. I can't afford it.
Mm.
So it's only in those kind of instances that we remove. And in some cases too, the tooth would actually get so terribly bad that the root canal treatments cannot work. Nothing can work than to
Yeah, to
remove it.
remove it.
And now plan for a replacement of that tooth. There are options of replacement for when we remove it like that. There are different options of replacement that we can explore depending on what the patient can afford.
Yeah. Thank you very much for that. Does it have to be hard brush? Does it have to be the hard way to brush our teeth?
This is where I try to explain to patients. If you for every car, over time the tire of the car wears off because
Mm.
of is it friction now? Don't mind
Yeah.
me.
Yeah.
Causing the tire to wear off over time. The tooth is like that too. Just like the tire is brushing against the road, causing it to wear off. Your brush over time against the tooth over time can start to cause the surface of the tooth to wear off. That
Mm.
enamel I spoke about earlier, that is the strongest in the body. As strong as it is, over time, you can start wearing it off. And once something happening to that enamel, there's a reason why that enamel is that strong. Like the reason why it is strongest in the body is even stronger than bone is because it is protecting very delicate tissues within the tooth. So basically, all efforts must be made to make sure that nothing happens to that enamel because It is protecting delicate tissues. Now, when something starts to happen to it, compromising that enamel, those delicate tissues in the tooth will start getting exposed, causing problems. Your hard brush causes your teeth to start wearing off, and the delicate tissues in the tooth will start getting exposed. That's when it will usually start with something like sensitivity. You notice that when you take cold water, you feel shock. Yeah, it's because your tooth is already getting worn off. Then from that, you continue, it can lead to much serious problems because the exposure will continue. Those delicate tissues will get more and more assaulted and exposed by where your saliva, water, bacteria should not be reaching, they'll start reaching it because the enamel is already compromised. That very strong enamel is already compromised. Don't want anything to happen to it. Hard brush, we don't advise it. And aside that, hard brush damages the gum, especially for people that brush like this. Brushing, scrubbing their teeth horizontally, that's not how to brush. Causing what we call gum recession too. When the gum will look, it will seem as if the gum is going up. Going up. For the upper teeth, it will seem as if the gum is going up or receding down for the lower teeth, exposing other parts of the tooth that should not be exposed, or exposing places that the gum should be covering because the hard brush is destroying the gum. So we don't advise hard brush at all. At all. Even for people who smoke. Personally, I don't advise them. For people who smoke, we advise that obviously we counsel them. For those of them that are willing, we can even counsel them to go for therapy and all that, seek help, and try to get help for them. Because smoking is inherently dangerous, causes different kinds of cancers, destroying the lung, and so other terrible things in the body and the mouth. They don't even advise hard brush because they believe that once you use that hard brush, because the tobacco stains on their teeth, those black stains, the hard brush will help them remove those stains. I don't, that's not even advisable. If there are tobacco stains on your teeth, you should go to the dental clinic so that your teeth will be cleaned professionally. We have our own equipment for cleaning that.
What is the best or the right way for us to brush our teeth?
There's a way to brush. I made a video on that recently. You don't scrub your teeth horizontally, moving it right and left. That's not how to brush. And you don't do up and down, brushing both upper and lower teeth together. You can take either the lower teeth or upper teeth first. You take that one first. Then for the upper teeth, you stroke down. You gently stroke the teeth down. You clean the outer surfaces. Then after that, you go to the inner surfaces. The inner surfaces of the tooth, you stroke down to. Then you now brush the biting surfaces, the chewing surfaces of the tooth. I'm not sure if this is making sense at all, but
It's actually because I know people that brush like if as if they are washing gutter, like the way
no,
they
no,
brush
no.
it.
No, it does not have to be like that. Then for the lower teeth too, you gently stroke up. You do the outer surfaces like that, the inner surfaces, then the chewing surfaces. Then after that, you brush your tongue.
But before we go, there's one aspect I want us to touch, and I know it's a very important part that if we are not careful, it might take a lot of time, and that's to do with children's teeth. At what age should children start seeing a dentist, and how often should they go for checkup?
Actually, we advise that at at the very least by age 2, the teeth will start coming out by usually for most children between 6 and 10 months. You notice the baby teeth will start coming out. But by age 2, it is expected that, or it is advised that every parent should have taken their child to see the dentist. We advise it very importantly. We don't play with children's oral health at all because once there's a problem, it's really burdensome for them as children, even
Mm.
for us, the dental professionals too. It's always tough when I have to do an extraction for a terribly decayed in a 6-year-old. In a 5-year-old, you have to give them injection in their mouth before you do the extraction to get them to cooperate and all
Mm.
that. It's not always easy. For children, more often than not, it's not just one teeth that will be affected. They will have multiple teeth that have decay on them. Some of them you have to put a filling. For some that are too deep, you might have to do some kind of extensive treatment to drill the tooth, to do all of that. It's not really easy to get children to cooperate. For dental, there's always a lot of hard work. And for them as children too, we don't want that kind of experience. So we always emphasize on preventing that problem from happening. So we try to emphasize preventive measures. That's why we see that by age 2, you must have been to the clinic with your child, so that we check, we counsel as appropriate. If there's any problem, we quickly fix it.
So, still on children's their teeth is not properly arranged. At what point should the parents get worried, or should they just assume that since it's still the first set of teeth, it will remove? Maybe when the permanent one starts growing, everything will align.
Usually, as a parent, if you notice that the teeth of your child, they are not well arranged, you will notice that you should bring them immediately. Depending on the age and the teeth present in the mouth at that particular point in time and the severity of the condition, there are different options we can explore. It's not advisable to say that until my child is now 15 years, when he's now fully grown, before I bring her. For now, no. You should bring them immediately. Yeah. For some, frankly, we just tell the patients, okay, let's wait and observe. In some cases where we have to intervene immediately, we do that. In some cases, we tell patients that, okay, we want to wait till all the baby teeth are out before we start treatment, and we explain the reasons. Like, it's not like there are different scenarios that can play out that would cause us to implement different treatment plans for the child.
Thank you very much for your time so far. I don't know if you have any parting words, general advice for people before we call it a day.
I would just like to maybe emphasize a little bit on something I said before. People say prevention is the best cure. I think that's a saying that people do. That statement is very true. It's very true. And I tell patients all the time. It's not just about your mouth, your teeth. Treat your body like that. Treat your body like that. Some people tend to treat their mouth with levity and a kind of like a lackadaisical attitude that is interesting. The mouth is as a part of your body, as important as a part of your body as your eyes, as anything. Like we've seen over and over and over with patients. Patients will come and they will say things like, I don't know a single tooth can turn my life upside down like this. It's always best to prevent. Keep a very good oral hygiene. Brush twice daily, very important. Once in the morning and the last thing before going to bed. Not that you would brush by 9 p.m. and you should go and take bread inside your fridge by 10. It has to be the last thing. Your mouth has to be clean before going to bed. Don't use that brush. Use a medium textured brush. Don't use toothpick. Please use floss. If meat gets stuck in between your teeth, don't use toothpick. Will damage your teeth, damage your gums, cause very serious problems. Dental floss. Use that to remove anything getting stuck. Go for regular dental checkups. Every 6 months, you should have a dental checkup. You should have the cleaning done. Also, make sure you reduce your sugar intake as much as possible, to the barest minimum that you can. And like I said, also people ask all the time, especially for people that come having to decay problem. Hey doctor, what kind of toothpaste can I be using that this problem will not be happening again? There's no need for any special kind of toothpaste. The special kind of toothpaste you need is the one that has fluoride in it. Most brands, the commonest brands, toothpaste brands have fluoride in it. If you are not sure, check it, make sure it has fluoride. Use it, and you're fine. Yeah, people are always looking for that special cure. Doctor, is that a drug I can be using that? No. Keep a very good oral hygiene. Come for regular dental checkups. Use a fluoride containing toothpaste. Take care of your mouth basically. If you notice anything going wrong, very little, come to the clinic as soon as possible.
Thank you very much for your time, Dr. Adeyemi. It's been nice speaking with you. So, where can people get more from you? I know you have a very large fan base, so that people can check, follow you, and then learn more.
My Twitter handle is at Dr IsaacK Adeyemi. At Dr IsaacK Adeyemi. The Twitter name there is Ask the Dentist NG. On TikTok, on Instagram, Ask the Dentist NG. Just search. I have loads of content there.
All right. Thank you very much. Thank you very much for your time.
And that's it, guys. We've had an exclusive interview from Dr. Adeyemi. He has broken down the nitty-gritty of the care of our teeth for us. He has explained to us how to brush our teeth and lots of things. I'm sure you enjoyed the video. Please hit the subscribe button, like us, share us, and let's grow this the community together. And until next time, when we'll be coming your way again, I remain your health enthusiast, that your Jerry. See you again next time.